Hello, and welcome to Beyond the Diagnosis. I'm your host, Monica, a neuroscience graduate and current medical student in Canada. Physicians are often regarded to have a very fulfilling, desirable career. But what often that's not talked about is behind the scenes. Today, our topic is about the mental health of physicians and physicians in training, from the perspective of someone who has served their community, but has also accessed the healthcare service. I feel extremely lucky to feature Jake, a resident psychiatrist. Welcome, Jake.
Thank you so much for having me, Monica.
Thank you for being here. So I was hoping to start off the interview by just asking you to please introduce yourself and just to tell us a bit more about how you got involved in the mental health advocacy space.
Sure. I'm Jake Goodman. I'm a resident physician. I'm in my third year of psychiatry residency training. That means I completed college, 4 years of medical school, a year of MBA, a master's in business administration, and now I'm in year 3 of 4 of my psychiatry residency training. I am a mental health activist. I make videos on social media educating people about mental health, and I help reduce the stigma associated with doctors and other healthcare professionals seeking help for their mental health. And I've grown a community of a little over 2 million followers and supporters across social media.
That's amazing. So I actually came across your videos when I was learning about the whole mental health advocacy space. Would you mind sharing a bit more about sharing your own story? Was that a little bit daunting in the beginning, or did that bring up any sort of emotions, or were you just from the get-go pretty open to doing so?
I guess I'll walk you through a little bit about my mental health journey that got me there. Basically, I started experiencing some symptoms of anxiety in medical school, but I didn't do anything about it. I didn't tell anybody about it. I kind of grew up with mistaken belief that physicians don't really struggle with mental health and that they can't or don't seek treatment for mental health. I grew up with this kind of idealized vision of what a doctor is supposed to look like. And I think I really believed that. And, you know, a large part of this is the stigma. I thought I'll just keep going. I can't seek help for this. It's all part of it. You know, it's all part of med school. I have anxiety because it's med school. I'll just keep going. So I never really got help. And I wish I did, you know, in hindsight. I kept pushing. I got into residency. I matched into residency. A few months into residency, I experienced a real severe depressive episode for the first time. And at that point, I'm a doctor who treats mental health, and I really couldn't recognize that I was experiencing depression until a friend of mine and also my wife had kind of told me, hey, I think you might be depressed. It's hard to see it in yourself sometimes. And ultimately, I decided to get help and get treatment. I went to a therapist and I went to a psychiatrist, started taking medication for the first time, and I started feeling a lot better. You know, over the months, I would just get better a little bit every single day. It wasn't ever noticeable. Like, it's not like I woke up the next day and I was like, I'm cured. It was more like, you know, weeks and months and months and months. And finally, as I'm getting better, I'm thinking to myself, like, at this point, you know, I probably had 1 million followers or 1.5 million. And I'm like, I should post about this because I know that there are so many other people out there that could benefit from this, that maybe are afraid of the stigma, just like I was. If they could see that there's a doctor out there who's open to taking medication and who openly says to everyone, yeah, I'm taking medication and that doesn't make me a worse doctor. In fact, the fact that I'm seeking treatment to improve myself makes me a better doctor, better than I was if I was just to suffer through this depression without any help. So I decided to take a picture of myself with a pill in my mouth with a caption of, I'm Dr. Jake, physician who treats mental illness, and I take medication for my mental health. And by the way, I'm proud of it. I hit post, went viral beyond belief, and that took me on a journey that I'm on today.
When I first saw that as well, I just felt so inspired, and seeing someone in the position where I hope to be being so open about this felt like, wow, someone really understands what it's like. and that there was a stigma in general in society, but I wasn't quite understanding about the whole culture of mental health within the medical profession. So one thing I wanted to ask you was then, what is the culture like in terms of how accepting people are, the resources available, while you're already in the whole medical space?
Sure. I'll give a quick, like, kind of 30-second synopsis of like where we came from. So I think people can understand how bad it used to be and how much better it is now. So residency training was really started, like the formal residency training that we know today was really started back in the late 1800s, early 1900s by a guy named Dr. William Stewart Halstead. He was a general surgeon out of Johns Hopkins, and he created one of the first residency programs, like a formal residency training program. And he worked his residents ungodly numbers of hours. I mean, they worked 24/7, 365, really no days off or anything. And because he really didn't sleep, he just worked and worked and worked. His residents did the same. And years later, it was uncovered that he actually had a substance use a substance use issue. He struggled with cocaine addiction and would work extremely long hours under the influence of cocaine. Now, he created this structure, and it had spread throughout the country. So this, whether you were in Baltimore or you're in Chicago, this culture of work, 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 work was already established. And it wasn't until the 1980s when an individual died in a hospital due to a medical error made by a resident doctor working 18 hours straight that a work hour restriction was made. That case was the case of Libby Zion in the 1980s, 18-year-old girl that passed away due to this medical error. So they created this 80-hour work week back in the 80s. Prior to that, there was no work hour restrictions. You could work 130 hours a week, truly. So now, we have this 80-hour work hour restrictions, 80-hour work week. There used to be really no restrictions on the amount of time that you could spend in the hospital. Now there is 20, I'm not saying this is good by any means. We'll talk about this. There's a limit of 28 hours in the hospital, which is horrible, but it used to be even worse. And so there's this culture of work till you drop and never complain. That's been going on for over 100 years. And there's also a culture of not reaching out for help when you're struggling. And that's due to stigma from colleagues and supervisors that if you reach out for help, maybe you're weak, you may be viewed as weak. Stigma that we put on ourselves that, we've worked this hard to get here, we don't need help. But one of the overarching themes here is also a fear of what could happen if you reach out for help and see a psychiatrist or get mental health treatment. And that fear is largely based on what will happen when you apply for your medical license. Because when you apply for your medical license after college, medical school, residency, there's a bunch of questions on this form. And one of those questions in most states, there's a question regarding your mental health. It may be something like, have you sought treatment for a mental illness? It's some variation of a question like that. And due to the fear of checking that box and somehow jeopardizing their medical license, many doctors in training, resident doctors, medical students, they never seek help at all, and they suffer in silence.
It's still going on now, you're saying?
Yeah, very much so. Although, and this kind of brings us a bit to the solutions and how things are getting better. There has been some major changes that pushing the culture. There was a physician named Dr. Lorna Breen, who was an emergency medicine physician who was really working on the front lines of the COVID-19 pandemic back in New York City, and she unfortunately passed away from suicide. And there was a foundation that was created because her family created this foundation. She sought treatment for mental health towards the end of her life, and ultimately was very afraid of losing her medical license, which most likely contributed to worsening of her mental health condition. So they created this foundation called the Dr. Lorna Breen Healthcare Foundation, and this foundation is working really hard to meet with different state officials to try to change the wording of the different state medical licenses that exists in Florida, California, New York. And so at this point, last time I checked, almost half of the states have revised that question to make it less intrusive?
I think that's really important because wording definitely will make a huge difference on the way that things are perceived, even like the connotations of things. While you were mentioning the struggle of seeking help due to stigma, one thing that came into my mind as well was, how does it work when a physician is hoping to also seek help from another physician who might be connected in one way or another to the hospital system?
Yeah, that's a great question, and it's unique to each place that people work at. I can't say that there's a general rule for this, but for example, many residency programs, if you're struggling in that residency program, if the program is progressive and actually cares about the mental health of their residents, they will have a system in place for those doctors who are struggling with their mental health to see providers that they won't have to work with. It would be quite awkward and perhaps unethical to be working in the hospital and get a consult. Hey, this is Jake from Psychiatry. Oh, aren't you the doctor who saw me for my, postpartum depression?
Mm.
That's not cool. So there's a lot of systems that are in place to prevent the psychiatry department in a hospital from seeing the trainees in that hospital. I can't speak for all hospitals around the country, but I know that that's a thing based on my conversations with other people in different programs. Doesn't always exist, but here's quite frankly what happens a lot of times is because of the fear of people finding out about mental health, a lot of trainees and also attending physicians will reach out for help in the private sector in a cash-only type practice where there's no paper trail within the institution itself. Some, will go as far as going to the county over or the state over to seek treatment. It's really scary what's happening. I think this is largely just due to the stigma. It is getting better, and there are more systems that are being put into place to help people that are struggling in these institutions.
So in sum, it's been really hard, but it's still quite difficult from what I hear.
Yes.
Stigma is one thing that persists throughout, though I do see that people are constantly making efforts to improve it.
Mm-hmm.
You mentioned being able to consult from someone completely separate, but I do acknowledge that there is still much more to be done. And that really brings me to then asking you mentioned stigma. What are other priorities do you think should be addressed within the mental health space for physicians and also physicians in training?
I would say one of the areas that could use the most improvement is eliminating barriers to treatment. So number one, providing like a wellness committee or some sort of actual structured support group for medical students or residents so that they could go and seek help. And for your medical school, it might be this counseling center, but for another medical school or residency training, maybe it's a psychiatrist, a staff psychiatrist that their sole job is to see people in the medical school or the residents, and they have a direct line of communication between the directly to the students or the residents. There needs to be someone who is accessible, who is not going to be unable. You have to be able to afford this treatment. Medical students get paid $0. In fact, they pay an enormous amount of money to go to medical school. Residency residents get paid very little, near minimum wage many times. So it needs to be affordable, it needs to be accessible, and there needs to be a reduction in the barriers to get there. And that barrier could be, on a large scale, changing the way that the state boards write the mental health questions in the licensing. But on a local level, it could be providing a union, so that a union for residents, so that you have representation. If things were to go down and someone was to discriminate against you based on your mental health or prevent you from seeking help, that you have a union that can back you up there. So that's kind of stuff that we can do from the local level and the national level.
From a more community kind of hospital level in terms of initiatives. What are your thoughts on like peer-to-peer listening services?
I understand why the peer-to-peer support groups exist, but there's got to be a way to reach a professional who's trained, really trained in how to deal with mental health crises situations, and how to conduct therapy, and also in medical school. Very rarely do we really get taught how to have these conversations about suicide. It really, you need to have a professional to speak to. And so a lot of these programs, hospitals, even businesses are investing in chief wellness officers who can basically come in. Chief wellness officer being a fancy term for person with mental health experience or background coming in to make a structured way to have people reach out for help if they need it. And really, truly, if you're listening to this and you're thinking about going to medical school or residency training program, you're interviewing, that's something I would include in your questions that you're asking these places. What systems do you have in place for a medical student or resident that happens to experience a mental health or a physical health challenge during their training? Do you have a system in place for accommodations or for resources, treatment options? There's got to be something in place. And if there isn't, I would say it's a major red flag, and I would honestly look elsewhere. I mean, I think representation matters a lot. And if there are people that are open to talking about their mental health, it kind of going back a little bit back to peer, like if I have opened up about seeking depression to my peers, if I'm comfortable doing that, and not everybody is, if somebody else experiences depression or some sort of mental health condition, they may feel comfortable coming to me and not necessarily sharing their story with me, but saying, hey, you got help. How did you do it? And I could say, oh, I reached out to the wellness curriculum, for example, or I found a doctor here who was really great. That's why talking about your story and mental health can not only help you and help your life, but it can really help those around you that are also struggling with similar things.
Are you able to speak on kind of experience as to what really gave you the courage to speak out when we also spoke about all the external challenges like stigma of like perceptions of what others might think of you, etc.?
Yeah, for sure. Because it's not like I just got better and hit post. I mean, that post sat in my drafts for like months because I was so in my head about it. Ultimately, what would happen is I would get on social media, and every couple of weeks I see another post of another resident doctor who ended their life by suicide. And it infuriates me. Why is this happening? Because these people, they come into this career to become healers, and they end up in a culture that works them to the bone. 80-hour work weeks, 24-hour shifts, hardly any time off for their friends, for their family, for their own mental health. And some of them feel that there's no way out, and they end their lives. I would see these posts on social media and I would just cry or fume or go to my wife and be like, what can we do about this? What can we do about this? Well, one thing I could do was share my story and hopefully reach people who are in that position of really struggling right now, or will be in that position at some point in the future, and hopefully think to themselves, well, that doctor on social media, he got help. He posted about taking medication. He ended up fine. He's still a doctor. Why can't I do that? It was really out of a desire to push the culture a little bit in a more compassionate direction. That's why I did it, and to really help people that are struggling or will be struggling in the future.
Well, I'm very thankful that you decided to post that because it really helped me personally. And I'm pretty positive as well that you've helped other people out there.
Thank you, Monica.
Thank you very much. On that topic of mobilizing social change, how do you see this happening on a more community level or a city level or a state level?
First off, I'll say, like, if if you're struggling with something, it is completely up to you whether you want to share or not. I think there is some advantages of sharing, especially with people that you trust in your social circle. You know, your therapist or your parents, boyfriend, whatever it is. But you don't have to, and there's nothing wrong
Mhm.
with kind of keeping things close to the chest. Some people are more like that. I will say though that if you do open up about what you're experiencing, it most likely will help somebody out there who is struggling. And so I'll say a couple things. Number one, just by having these, and they don't have to be these groundbreaking conversations. You don't have to post on social media with a pill in your mouth. I did that really to push the culture. What would be immensely powerful is to talk to somebody about the fact that you got a therapist and you saw a therapist. Just that right there, that's huge. I grew up most of my life thinking I'm never going to see a therapist. Why would I need to see a therapist? Like, people who are really sick need to see a therapist. That's what I used to think, because I really fell into that culture. I think, like, being a man, especially like a boy growing up, like that was very much like, don't see, what are you going to go see a therapist for? But when I hear, and other people hear, people talk so openly, oh, my therapist said this, or oh, my therapist is really XYZ, like just saying that has so much power. Also, when we're talking more about the local level, I'll touch on unions again, because I think that's something that we are really moving in that direction when it comes to residency programs. I think 2023 was a record year of new unions being created around the country for residencies. For the longest time, residents really have had little to no power, and they don't have a lot of opportunity to get their message across and advocate for a more equitable workplace environment. Unions are changing that and giving doctors a voice and a seat at the table. And that can also benefit mental health as well, because unions can do things like create wellness days, mandate wellness days into the curriculum so that doctors are required to have time to go to their appointments. You know, an orthopedic surgery resident working 95 hours a week, if they develop diabetes, it's going to be really difficult for them to go to their physician to get the medication that they need and do the blood work that they need to do. So, having unions can create a culture where it's really structured and mandated. Residents have a minimum of 5 wellness days or 2 wellness days. Residents cannot work more than X number of hours on this service. They are able to really give residents a voice. So I hope that kind of answered your question. There's some things we can do individual, and there's some things that we can do in a sort of local type setting.
I really like the message that really came out, which was the idea that it doesn't have to be something huge in the sense of, let's say, like posting a picture of a pill in your mouth. It could even be something simple as self-acceptance. Then moving on to things like you said, when we're going at an even higher level, the role of unions. So I think it's a good summary of like community initiatives that we can definitely push for and focus on. And from, I guess, the kind of highest point of view in terms of federal initiatives, you did mention before like the change of the way that the mental health question is asked in residency applications. Do you know of any other initiatives that people are pushing for in terms of improving the whole kind of culture of mental health barriers that prevent people to seek help?
Number one, I think it's important to know what state you want to practice in. There are some states out there where the question is incredibly vague and by default intrusive. Like, I don't know if the wording is exactly this, but something along the lines of, have you ever experienced a mental health condition that would, impair you, or something like that? Like very intrusive question. Like, so what if I, had depression in medical school, my first year of med school, studying for step 1, I have to report this on here. It's been 7 years, So I think number one is like, think about what state you want to practice in, and maybe if that state is to the point where they're asking incredibly intrusive questions like that, it may not be the right state for you to work in. I know it's easier said than done. I know families are involved in where you want to work and live and stuff like that. So it's not that easy. But also think about where you want to practice from a medical standpoint too, because there's a big difference between practicing in Alabama and practicing in California for many reasons. Not good or bad about either. I'm just saying that if you do your research before you decide you want to practice in one of these states. Now, some resources: the Dr. Lorna Breen Foundation. They're the ones. They are doing some of the most groundbreaking work. They met with President Biden, and have been really pushing. So if that's something you're interested in, you definitely look them up. Dr. Lorna Breen Foundation. There's a great one for nurses that I actually just saved here recently. Don't Clock Out is a really good one that are specifically for nurses, but I know they're also involved in just kind of general healthcare help as well. And I actually just saved this post here. Another one is the Physician Support Line. So you can Google this: Physician Support Line, free confidential support line for physicians by physicians. Therapy Aid Coalition. This is free and low-cost therapy for healthcare workers. A lot of people may not make enough money doing what they do in healthcare, and this provides free and low-cost therapy options. And then the last one I'll say is another organization called Debriefing the Front Lines. This is one that provides psychological first aid for people. I've seen it used mostly in nurses, but it really helps people that work like in emergency room settings that are experiencing a lot of traumatic things. This is a chance for you to really get things off your chest. And then lastly, of course, I'll always plug 988, 24/7 staffed crisis hotline, staffed by trained mental health counselors who can talk you through really any mental health condition that you're experiencing and provide you with some next steps for where you could go.
Thank you for sharing the resources and for really discussing points for mobilizing change, not only from a personal level, but also from a community level and touching on a national level. I feel like we touched on a lot of different potential interventions, and I'm very grateful for that.
Thank you, Monica.
Thank you. And for just the final question, if you have one single message that you would like to share to incoming or current physicians or physicians in training in terms of mobilizing change to improve the mental health space, what would it be?
Representation matters. And I give an example here of a friend of mine who ended up becoming the Surgeon General for the state of California. And in her last day in office, she opened up and did an op-ed about experiencing bipolar disorder as a physician. She became the Surgeon General for the state of California. Representation matters. And for people that experience bipolar disorder, they may think to themselves, well, maybe I can't even become a physician. No, you can. Not only can you become a physician, you can become the Surgeon General. So representation matters. There is somebody in your shoes who is experiencing something similar as you, who has gotten to follow their dreams and become anything they want to be. Your mental health will not hold you back, especially if you seek treatment for it and do the work. Your mental health will only become just a part of you that makes you you. And if you want to become a physician and you think that there's some reason why you can't, I promise you can. I promise you can. If I did it, you can do it.
Thank you for leaving us with such an empowering message. If you have any other projects you're currently working on, any other advocacy initiatives, anything, I just want to give space for you to also share it.
Feel free to follow me. I'm Jake Goodman, MD, Jake Goodman, MD on all platforms. But the one thing I'd love to plug is that I'm dropping, you're the first to hear about this really, I'm dropping a children's book about mental health in 6 days. By the time you hear this, it will be out. It's called Psychiatry for Kids. And it's a book teaching mental health concepts from depression, anxiety, schizophrenia, autism, ADHD, teaching these concepts to young children, trying to teach them the importance of what a mental health condition is and what you can do about it. So if you're listening to this and you have young kids or a cousin or you just want it for yourself, just to read a little bit about what these conditions are like, check it out. Psychiatry for Kids, co-written by me and two of my physician friends who are a dermatology and ophthalmology duo, husband-wife duo. And we wrote the book to just try to change the culture a little bit and teach kids what we wish we would have learned when we were kids.
Big congratulations. And thank you again for everything you do for the mental health community.
Thank you so much for having me, Monica.
Thank you very much.